Hi, I'm Neil Lincecum. I'm a hand surgeon at Ortho Kansas. I was an engineering major before I started thinking about medicine, and so I got involved in a bioengineering research group and happened to be assigned a hand surgery project, and so that's sort of where all that began. But the engineering of any field in medicine sort of translates into orthopedics as much as any. So. Patients. Particularly here in Kansas, I think it's a great cross-section of the patient population. You meet some amazing people, and so that's the best part of being a doctor, at least in my profession. So my subspecialization is hand surgery. I did special extended training in that, so that's my area of concentration and interest. Of all the orthopedic subspecialties, hand surgery probably has the widest variety of types of problems, age of patients, acuity of problems, so it's always something new and different. I think my philosophy of care is, in a literal sense, conservative, in terms of I think most people don't come in wanting surgery, and so if we can solve your problem without surgery, that's usually what we'll try first. And then collaborative is the other philosophy word I would use, and that I want the patient to feel like that they have input on, and certainly final say on, what we're doing for their problem. I'm a Kansas kid, right? I mean, I grew up, my mom's from Western Kansas. I've been driving up and down I-70 since I was a little kid, and so I just love the state of Kansas, and I'm glad that I was able to end up back here. It always helps patients just in general to have a primary care doctor. I'm always concerned about the amount of patients I see that don't have a primary care doctor. Even if you're healthy, you need a primary care doctor to sort of be the captain of your ship, and if you do have problems, they're going to be a great resource for you. They may also, with preventative care, keep you from having problems that you wouldn't have otherwise. So I think that would be my first recommendation: make sure you have a primary care doctor. And then the other thing is, relative to coming to see me or seeing any doctor about a problem, is think through the problem a little bit before you go, so that you have some specific things like, it particularly bothers me at this time of day, or when I do this activity, or it affects how I play the piano in such and such a way, or it bothers me when I eat this certain food. The more clues you have for us, the easier it's going to be for us to solve the puzzle. I think they should come to Ortho Kansas for their medical care, because we have an excellent team, and that's top to bottom. And it starts with the people that greet you at the front desk, right through every person that you'd interact with here. And it's always been a great place to work, and I enjoy the people that I work with. And people come in here not because they're feeling great, but because they have a problem, and I think everybody here is pretty compassionate and understanding about that. And I really hope that we continue to meet that standard.